Hello, welcome to the Healthy Alternatives podcast. I am Dr. Christine Sauer with DocChristine.com. Today's show is a recording of my radio show of the same name. Enjoy! Good afternoon, this is Dr. Christine Sauer, your host of the show Healthy Alternatives here on 97.5 CIOE FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare, and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well, so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you, there is a light at the end of the tunnel. I'm asked very often to give some information about nutritional supplements, which one are good to take and what the benefits or dangers are. So we are doing a series of structured shows going deeper into health topics. Today, my fellow health coach, Jennifer Gugger, and I will be talking about B vitamins. Thanks, Jen, for coming here.
No problem. Thanks for having me again.
Well, that's wonderful. I always enjoy talking to you. You have a wealth of knowledge, nutrition-wise, and that's always a pleasure to combine our experience and knowledge.
Oh, thanks. Yeah.
So, as always, I want to start with a word of caution. Although nutritional supplements usually are safe, there are exceptions. This show is meant educational resource only, not as health advice. If you need individualized advice, have any serious health conditions, or take prescriptions, medications, please ask your physician, pharmacist, or other licensed healthcare provider for advice.
For sure. So B vitamins is our topic today. Okay, so huge range of
There's
these.
so many B vitamins.
Exactly. I think some of the more familiar ones to people are probably like B1, B3, B6, and B12. But if you really take a big look, they can go right up to 19.
Yeah, it all depends on the numbering. Many are cofactors.
Okay.
And they just gave them a number.
Okay.
But the most common one are the 8 actually,
Okay.
that we were mentioned today. And they are quite important. And all B vitamins are water soluble, which is
Right.
important because it means if you take more than what you need, your kidneys pee it out.
Okay.
That means your kidneys have to be okay, or you might get side effects.
Yes, for sure.
Now, why don't we go by the numbers and start with B1?
Okay, sounds good.
B1 is known as thiamine.
Right.
And it is important because if you don't have no thiamine, you have beriberi, a deficiency disease, which is quite unpleasant. What does vitamin B1 thiamine do? It helps convert food into energy. It's an important cofactor, as are all B vitamins are important energy cofactors that we need. So when people are tired, many people I see are chronically tired and don't know what to do, and B vitamins are an important part of that. So
you hear a lot of people going to get like a vitamin. I believe I'm not sure if it's B6 or B12 shot from their doctor. B12. Okay. Yeah, you hear that quite a bit.
It's weird because really B12 is very important, and we'll talk in the second half pretty much only about it because it is so important.
Okay.
But the others are important too, and there's other cofactors in nutrients. And we always say supplements and nutrition is like an orchestra.
Right.
You need all the players to get the symphony.
That's right.
And if you just take one and the rest are missing, oops, it doesn't sound good.
That's right.
And you get sick. So where can we find B1, for example?
Well, something that I noticed is a lot when you look on cereal boxes, for instance, you see a lot of these B1, B2, B3 added. And you also see them added quite a bit in conventional white flour.
Yes, to avoid deficiencies.
Okay.
Because the whole grain has a lot of B1. When you isolate it and make it white flour, the processed white flour,
okay, it loses it, right?
It loses all the nutrients. And so when they introduced white flour and everyone went on the craze in the 1930s, many people developed deficiency syndrome.
Makes sense.
And then they realized, when we want to sell that white flour, we have to at least add a little bit so the people don't get too sick from it.
Right, exactly. So it's not like some people, when they look at labels, they think, oh, okay, so this has the B vitamins, so I must be getting what I need, which really is a misconception.
Or it says enriched flour.
Right.
So they think, oh, it's rich.
Exactly.
It's good for me.
Exactly.
But generally, white flour, processed flour is not good for you.
Right, for sure. So the B vitamins are found in whole, unprocessed foods. So is there some that are specific for the B1 thiamine?
Well, B1 is really everywhere, but especially in whole grains, beans, spinach, green leafy vegetables, kale, even nuts, sunflower seeds, and in meat, all kinds of meat, and even in yeast. Yeast is rich in B vitamins. That's why vegetarians are usually, if they're not allergic to it, eating nutritional yeast.
Right.
It is high in B vitamins, which they otherwise do not get enough sometimes.
Okay.
And it doesn't get absorbed well, because it's always an interplay. We are not really what we eat, we are what the body absorbs.
Right, exactly.
That's a big problem nowadays, because most people of the modern world have what's called leaky gut, take medications.
That's right.
And it all interferes with the absorption.
For sure. And as we mentioned before in past shows, with the lack of nutrients in our soil, our fruits and vegetables aren't what they used to be.
Not at all,
when it comes to, vitamins and having all that good stuff.
And all the toxins we introduced. And it's terrible. Alone the glyphosate.
Exactly.
And I actually watched a show for physicians on the weekend, and they said it's not only causing leaky gut in the bowel,
right,
but it's also causing the kidneys cells to pull apart.
Really?
And the bowel has a big importance for the brain health. We'll talk about that later in a later show again. But the kidneys have an important role in brain health too, because without functioning kidney, you lack dopamine.
Okay.
Dopamine is a happy hormone.
That's right.
And many people with chronic kidney disease, or not only chronic but just beginning, are starting to feel tired and a little bit down in the dumps. That may be a problem.
It's probably a correlation that a lot of people aren't aware of.
Yes. And it is quite extensive what the glyphosate does to us. So let's go with the list a bit down. The B2, the riboflavin, helps the body to break down carbohydrates.
Okay.
Which is important too.
Well, considering the amount that we eat these days.
And white sugar has no nutrients.
Right.
So it needs extra vitamin B2 from other areas of your nutrition. Many people don't get that.
Right.
So that's why white sugar is not good for you.
That's right.
If you want something sweet, use maple syrup. It has a little bit. Or use something natural sweet.
For sure.
And all B vitamins are important for all issues in the body. That's the thing. B3, niacinamide, is known to help the digestive system, skin and nerves, but it also taken in higher doses to reduce the blood cholesterol, which works to a certain extent, but it causes a niacin flush.
Okay.
When you take it in higher dosages, which is harmless, but when people take it and they get red and itchy, they think they're allergic. It's niacin flush. It's harmless, and after half hour it's gone. And after a while, you don't even get it anymore. B5, also known as pantothenic acid.
Right.
Now, need for our bodies to break down fats and carbs as all B vitamins. And for the skin, B6, very well known for brain health, is pyridoxine. And all those forms have to be in a certain form for the body to be absorbed. As we get older, we need the already finished form. We'll talk a little bit more about that in the next thing. And then, of course, we have B7 biotin, which people always think is good for the nails.
Right.
It is needed for the nails and hair, but not just that.
Okay.
B9 is known as folic acid.
That's right. I didn't realize that, and I think a lot of people maybe when they think about folic acid, they don't realize it's a B vitamin.
And we'll talk a little bit about the methylation of B vitamins and why this is important for our health when we get older in the second half too. And folate is one of the ones that many people cannot absorb in its acid form that is in most supplements.
Isn't there something now, a little bit of a controversy maybe with taking the folic acid during pregnancy? Typically, you're encouraged to take a multivitamin, like a prenatal, that has more folic acid in it. But I've been hearing lately that now some doctors are not necessarily recommending that.
I think the folic acid is good if you don't take too much, but it's important to take it before you plan to get pregnant.
Okay.
And then it prevents often neural tube defects like spina bifida.
Right.
If women take folic acid or folate supplements before they get pregnant, the risk for the child to get that is very much reduced.
So it's not necessarily during pregnancy.
We still need folate in a resorbable form, but not as much as before. Because once a child is in the womb, it's a little bit too late. It's already formed.
Okay, all right.
And we'll talk about B12 a little bit in the second half. And this brings us to the end of the first half of today's broadcast here on 97.5 CIOE FM Community Radio. Please tune in after the commercial break for more about the B vitamins. Thank you. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE FM and on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today we are talking with my fellow health coach, Jennifer Gauguin, about B vitamins. In the first half, we gave a little overview about the most common ones. And in the second half, I would like to talk a little bit more about B6, the pyridoxine, B9, the folate, and B12, the cobalamin, and why most supplements are no help for us. Now, you mentioned in the break that there's an interesting quote you found.
There was. It was not specific to any particular B vitamin, but just in general, that a lot of energy drinks have, and you see in water as well too, B vitamins added, and it says it helps consumers, and this is a quote, sail through your day without feeling jittery or tense.
It would be nice if that would be true.
Yeah.
And the problem is that many manufacturers add some cheap vitamins to their food to be able to claim benefits that they think their products will convey to the people. And the main purpose of that is that when people look on the label and see all those vitamins listed, they think, oh,
I'm getting my daily intake. This is great.
I call that vitamin sprinkling.
Right.
Because they put a little grain of this, a little grain of this, a little grain of that, and mostly in a form that we cannot absorb.
Okay.
And without thinking of the needs of the individual.
Right. So it's more for a marketing
it's a marketing thing.
Yeah.
It really is not beneficial. Mm-hmm. It's always best to eat the food in its original state.
That's right.
As little processed as you can.
Mm-hmm.
But if you eat something processed, it's always good to have it non-GMO.
That's right.
And the problem is nowadays, with the vitamins, especially B6, B9, and B12, that we need it in a certain form. The older we get or the sicker we are, because the original or synthetic forms are often not well absorbed or have actually opposing effects.
Okay.
For example, when you eat a lot of folic acid,
right,
it actually inhibits the formation of the form that you need, which is 5-tetramethylfolate. Terrible word, but I want to emphasize the methyl part because many people have heard of the methylation, MTHFR,
right.
the problems that many people have. Some of it can be genetic, some of it is epigenetic, that means it comes from the environmental toxins that basically deactivate our enzymes, make them weaker. And when we get older, our enzymes get weaker in that sense too.
Okay.
So that's why I always say we need it in the methylated form. For example, not to take orally through the mouth cyanocobalamin, which is a cheap form that you see everywhere, but to take methylcobalamin, which is a form that we can absorb. The best way to get it is as a lozenge. Put it under your tongue.
Okay.
And let it dissolve. Don't chew it, don't eat it. Then it goes under the tongue, lots of blood vessels, and it's like a little injection of B12.
Okay.
Of course, when you inject a fat-soluble form of B12 or injected intramuscular, the cyanocobalamin, it goes directly in your blood.
Right.
But not everybody wants to inject themselves or have the doctor give them needles all the time. So that's a viable alternative unless you're severely deficient.
So where could you buy something like that? Like at a health food store or?
Really, you can go to just kind of every supermarket. You can look online, and I don't want to let down, but there's a big wholesaler that many people go to that actually has a 1200 milligram methylcobalamin in lozenges. That are very reasonably priced.
Okay, sounds good. Sounds good. And that would be written right on.
That would
be
written. Yeah, don't just look for vitamin B12. Look on the ingredient list and see what it is. Don't take cyanocobalamin, take methylcobalamin under the tongue and 1,000 micrograms a day if you want to. I wouldn't go too high because it has to be an orchestra.
Exactly.
Now, why would people take it in the first place? Why don't we get it from the food? I think the main reason may be that people just don't eat a varied diet, high in protein, high in healthy fats and vegetables and fruits.
Right.
Where can we find B12?
B12 can be found in, well, like you said, protein. So chicken.
Animal
beef,
protein.
Exactly. Pork, clams even. Again, where these are animal proteins for anyone who is vegetarian or vegan, B12 is not naturally occurring in plants. So those of you who are vegetarian or vegan would definitely benefit from a supplement for sure.
Yeah, I agree with that. And they at least should be tested. There's a blood test for it, but it's not very reliable because it shows you what's in the blood, which shows you if there's a great deficiency.
Okay.
But it really doesn't show how much reaches your brain and gives you the energy you need. And with the folate, I really think you should look into natural folate forms, not just the acid, but a methylated folate, which is much better resorbed.
Or again, in terms of food for the folate, dark leafy greens.
They're so good for you.
Oh, they are.
You can make them taste good.
And now the weather is getting warmer, so it's, you don't mind kind of eating. And you look for a salad more so in the spring and summer than you do kind of during the winter.
Now, many people like the iceberg lettuce. Is it a good idea?
No, that's the worst. That's probably the least nutritious of all. It's not really even considered a green. It's just so full of water. A better choice would be spinach, kale. Oh my gosh!
Even romaine lettuce. At least
right.
It's the green leaves with it.
Definitely better than iceberg, for sure.
Yeah. I know my husband always comes, I want some crunchy iceberg lettuce. And I said, I'm not buying your iceberg lettuce, I'm buying romaine. Okay, he says. And I always mix a few leafy greens in it, those baby leaves.
Oh, definitely.
Well, you can grow them on your windowsill. They're so easy to do.
That's right. They're really easy. Or if you have a little, like for us, we don't have a huge backyard. We just have a little patch, but it's big enough to grow some spinach back there. I've tried arugula, kale. Yeah. So.
And last year I made actually kale spinach. Because my kale had so many holes.
Okay.
And I thought, they don't look good for kale chips, so I just cooked them and mashed them and put a little Himalayan salt and a little bit real cream in it.
That sounds good.
That's good. Well, I'll leave you with that positive thought. Eat a salad today. Eat some leafy greens.
And get your recommended amount of vitamin B12 or 9.
No, not B12.
Oh, sorry, 9.
Have some chicken with it or some beef. Beef liver is really good if it's a grass-fed beef. Otherwise, I wouldn't eat beef liver.
No, definitely not.
And this brings me to the end of today's show. Thanks, Jennifer, for chatting about that interesting topic about the B vitamins. It's in everybody's mouth by supplement or hopefully mostly by nutrition. And please don't hesitate to contact us with any questions, thoughts, comments, or suggestions. My email here is Christine, Christine, @communityradio.ca, or contact me through my website, docchristin.com. And I'm always grateful for any feedback. I also want to extend a special thank you to today's producer, Jim Wombold. Thanks, Jim. Great job. You might not know this, but this is a volunteer-run non-profit radio station, and we even have an art gallery. If you're local and you'd like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. Thanks, Jennifer, for chatting to me, and thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE FM Community Radio with live stream on communityradio.ca for the next episode. Thank you and goodbye and have a great day.